TV measurement is challenging. Let me actually give you a story. I was in New York last week on business trip, and in my hotel room as I was streaming a show, I came across a CTV ad about a Broadway play called Art. I was curious, so I Googled it and sent it to my friend who I was meeting next day. And next day, I'm busy in meetings all day, and my friend ends up buying us 2 tickets. Now, the show was great, but in the middle of it, I found myself wondering, would that CTV ad ever be credited for the purchase that my friend actually made? It's really challenging, right, to make that connection from all the way to exposure to the actual purchase, because it could include a lot of different channels. TV has a halo effect on other channels, increased searches. So it's very challenging specifically for TV. There are three things I would say. One is the attribution, as I mentioned, how you attribute the TV ad exposure to the purchase directly. 2 is time delay. In my Broadway example, the purchase happened the next day. But when I think about in healthcare, that can take weeks, months, maybe years even. So it's very hard to make that connection when there's such a time delay between. And third is the audience fragmentation as well. There are now so many TV platforms, linear and connected TV. The audience is so fragmented. If you're not consolidating them through one platform, it can be really hard to track audiences fragmented in different platforms.
So what does success look like for Genentech when it comes to campaigns, healthcare campaigns?
Yeah, for us, success is definitely not reach or impressions. It's more about the behavior change that we are driving and the incremental revenues that we are aiming for. That's really how we would define success.
And for real-world health outcomes in RxLift, which KPIs are you seeing tell the full story?
Yeah, so reach for sure, even though it doesn't give the full story, that's a KPI that you should look into, just so that you know executionally you are reaching an audience that you intended to reach. And then we look at search lifts and increase in branded search volume, as well as our web traffic. That is the intentional action somebody takes right after getting exposed to a TV ad. And that's a really meaningful metric that you can get instantly as well, so that can kind of show that you are on the right track. And third is incremental revenues and ROI, of course. That's the holy grail of every advertising campaign. And you can do modeling, and you can see if that TV exposure really led to a purchase. And finally, because TV is more upper funnel and really focused on awareness and consideration, you could drive brand lift studies to look into aided awareness, unaided awareness, as well as consideration. Those are helpful. That gives you a picture for the brand across different channels. Sometimes we do include the source of awareness in those surveys. I would always take it with a grain of salt, though, because it's not always the same. What people say in those surveys and what actually happens may not match all the time. So I would take it with a grain of salt, but they are still helpful.
And there's a lot happening in the technology space and the healthcare space. So what tools or partnerships are helping you better connect TV exposure to patient behavior?
Yeah, especially for those, the linking between exposure to TV ad data to the branded search or website traffic. There are statistical models and tools that help you do that. To be able to they get the minute by minute TV airing data, as well as your branded search volume, as well as your web traffic, and they can create a statistical model that helps you identify which channel, which program drove the biggest branded search lift per dollar or website traffic lift per dollar. Those are very helpful tools. And I mentioned incremental revenues and ROI, of course. We rely on a time decay marketing mix model tool to calculate that. That way we know that the tool is taking into consideration all of the touch points that was part of that journey, but giving a heavier weight to the last click or the last touch point. But that way, TV can still get a credit even if they're not the last touch point.
And in terms of measurement, what have you seen as the biggest shift in how you measure the impact of TV?
The biggest shift is what I mentioned was the really shift from very much focused on reach and frequency to the outcome-driven KPIs. We are no longer satisfied with just getting it reach and frequency or GRPs when it comes to TV measurement. As performance-driven marketeers, we are more focused on what people do after they get exposed to the TV ad. So that's all of those ROI metrics that I mentioned, incremental revenue, as well as the actions that they take around either searching for your product or going to your website and learning more about those products. Those are the valuable actions that we would want to measure, and that's the biggest shift that I've seen. And going back to my Broadway example, that would be the only way that that CTV ad would get credit for that purchase that my friend made, right? Because there's a lot of complex touch points and different things going on in the journey. But if you do a modeled approach, you would still give that credit to the TV that it deserves.
What does success look like for Genentech when it comes to healthcare TV campaigns?
Success for us is the incremental revenue and ROI that we can drive with TV ads for the brand, as well as the impact that we create on patients' lives. And of course, in healthcare, the journey from ad exposure all the way to prescription can take much longer than my Broadway example. So you have to look into some of the signals along the way, such as what people do after they get exposed to the ad and where is your brand awareness at along the way too.